it ended the stream, so now I'm like trying to kickstart it back up. I'm techie, but not this techie.
It'd be interesting to somehow get what's your name? The superintendent
Mm-hmm.
in this room.
Yeah, that's what we need. That's what we need. Mm-hmm.
See, what they're doing.
Hey, we are back from a quick caucus. We are ready. Robert wanted to say one thing, so we'll let him do that and then get into the FNS pilot.
From Matt at the last board meeting 2 months ago, your CEO or COO, excuse me, and your director of transportation was asked not once but twice, what is your exit plan for outsourcing transportation? What is that plan?
Watch the board meeting.
Twice you were asked. No, your COO and your transportation director. Your transportation director admitted that it's not sustainable.
Yeah, I'd be happy to follow up with Jeff and Terry. Okay, we have two parents from the FNS pilot working group with us today. I'll let them introduce themselves, but they are here to share the MOU counter that we have. They have been crucial to the work that we have been doing in the pilot. And I'll let them introduce themselves.
Soy mamá piloto de la escuela Jefferson. Y voy a... Mi nombre es Azucena Rubí. Memoranda de entrenamiento del Distrito Escolar del Condado de Jefferson. R-1, el distrito. Asociación de Profesionales de Apoyo a la Educación de JESPA. Para el año escolar 2024-2025, SY 24-25, los servicios de alimentación y nutrición de JESPA, FNS, han identificado 3 escuelas para preparar y servir comidas todos los días, usando recetas culturales relevantes proporcionadas por miembros del grupo de trabajo en la comunidad de Edwards. Las escuelas incluyen la escuela primaria Edwards, Jefferson Junior y la escuela Lambert. Y luego se propone expandir a 2 áreas de articulación por más años escolar. Con el enfoque de la equidad y elevar las voces de las familias, las recetas serán modificadas para compartir con los estándares nutricionales del Departamento de Agricultura de los Estados Unidos, la FDA, y para el uso de producción en gran escala, como lo exigen las políticas federales. La FNS, en coordinación con los equipos de trabajo identificados a continuación, trabajarán para desarrollar en forma creativa de mejorar la introducción más elementos culturales relevantes en el menú y buscar ingredientes de calidad de origen local como sea posible, de procedimiento mínimo. Antecedentes: el distrito, los servicios de alimentación y nutrición, la comunidad JESPA y otros grupos representativos, incluyendo a JESPA, acuerdan trabajar juntos para mejorar las proporciones de servicios de alimenticios para continuar mejorando la calidad y las comidas nutritivas para todos los estudiantes. Es esencial que los equipos de trabajo comprendan las regulaciones de programa y las limitaciones que pueden existir a la zona de entregar y resultados a torno de estas comidas. Los grupos de trabajo unirán esfuerzos para desarrollar una visión común, trabajar con confianza y con un respeto entre todos. Propósito y estructura. El propósito es el desarrollo de una visión y objetivos comidos para continuar mejorando las comidas nutritivas y de calidad para todos los estudiantes. Esto se logrará mediante la cooperación del facilitador, el grupo de liderazgo central, el grupo de trabajo, y el director de operaciones.
Todos los miembros de estos grupos se comprometen a trabajar con autenticidad, en unión y de buena fe en la búsqueda de soluciones. Facilitador. El facilitador será responsable de lo siguiente: coordinar, crear, comunicar y distribuir la versión final de la agenda para todas las reuniones con los grupos, equipos de trabajo. Facilitar todas las reuniones, guiar y gestionar a los grupos de trabajo para determinar una visión común con objetivo y medidas de evaluación. Asistir a los grupos de trabajo para mantenerse enfocados a la hora de tomar decisiones y resolver problemas. Resumir todos los puntos de la agenda y las discusiones y comunicarlos después de cada reunión con los equipos de trabajo. Grupo de liderazgo central. El grupo de liderazgo central estará compuesto por los siguientes miembros: el facilitador, un representante de servicios de alimentación y nutrición, un representante de JESPA, un representante del grupo comunitario, un representante de las madres de familia. Todos los integrantes del grupo de liderazgo central se comprometerán a participar activamente en juntas. El grupo de liderazgo central será responsable de lo siguiente: establecer fechas y horarios para las reuniones, planificar y contribuir a la creación de la agenda de todas las reuniones con los equipos, comunicar los temas de la agenda al facilitador. Grupo de trabajo. El grupo de trabajo se reunirá mensualmente. El grupo de trabajo estará compuesto por los siguientes miembros: padres de familia, miembros de la comunidad, miembros de JESPA, estudiantes de JEFCO, directores de JEFCO, miembros del personal de FANS, grupo de liderazgo central, facilitador. El grupo de trabajo escuchará y buscará entender el estado actual y las restricciones de FNS. El grupo de trabajo será responsable de los siguientes: colaborará para crear una visión compartida que incluya analizar múltiples métodos, operaciones para lograr una visión compartida y trabajar para crear un plan de acción específico para lograr la visión compartida, una vez que ya haya determinado la misma. Coordinar con el personal de servicios de alimentos en creación del menú y las recetas y participar en las pruebas de degustación. Apoyar a servicios de alimentos con la distribución y recolección de encuestas estudiantiles. Informes. Al final del año escolar 2024-2025 se presentará un informe final detallando los resultados y las recomendaciones basadas en las medidas de evaluación acordadas, incluyendo el proceso y los desafíos del programa, al gabinete del distrito y a la Junta de Educación. Financiación. Cuando sea posible, FNS, con la cooperación de los grupos de trabajo, se compromete a buscar becas y fuentes de financiación alternativas para la adquisición de equipo necesario. Duración. Este es el MOU independiente y no es parte del acuerdo de negociación colectiva de JESPA. Este MOU estará activo a partir de agosto 1 del 2024 y expirará el 5/31/2025. Tras la expiración de este MOU, el servicio de alimentación se compromete a ser un participante dispuesto y honesto en conservaciones con la comunidad en relación a las comidas de calidad y nutritivas para todos los estudiantes. El Servicio de Alimentos se compromete a continuar reuniéndose con el equipo de trabajo para avanzar y promover alimentos que sean mínimamente procesados y minimizar el uso de productos locales. Gracias.
Okay, I'm going to read in English now. I want to state for transparency, there was some issues in translating our counter to what was read right now. Okay, and I'm going to try and make clear what we are actually, the language we're actually countering. And that is we apologize. So there's going to be some language that I read that might not line up to what you just heard in the translation. Okay, great.
Basically, not everything got interpreted, so we always, when we're doing bilingual, the English version is the guiding, whatever that legal term is, the guiding document.
I'm going to read the parts that we are changing or countering, not the entire document. So statement of commitment. Jeffco Food and Nutrition Services, FNS, will serve scratch cooked meals every day using culture.
Sorry, I interrupt you. I just want to make sure that it's up on the stream. People see it, okay? Sorry, I didn't mean to interrupt you.
No worries.
Good.
Cool. I will start over because it didn't get very far. Okay. Just remembered something I wanted to say, so that's good. I'll start over. I wanted to mention and reiterate this work has been years of interest from the public, from the community. There was a task force on food in Jeffco years ago, pre-pandemic, and we all know what happened with COVID. So there has been a very strong interest from the community for making food service better in Jeffco and to invest in food for our kids. So I will start with the statement of commitment. Jeffco Food and Nutrition Services will serve scratch-cooked meals every day using culturally relevant recipes provided by members of the working group. The pilot will continue in Edgewater Elementary School, Jefferson Junior and Senior, and Lumberg Elementary School, then expand to 2 additional articulation areas per school year with a focus on equity and family voice. FNS, with the cooperation of the community, including the stakeholders identified below, will work to develop creative ways to improve and introduce more culturally relevant menu items and use fresh, locally sourced, high-quality ingredients with minimal processing. The stakeholders will commit to developing sustainable food service practices and include nutrition education for students. Down to the background, the District Food and Nutrition Services, the community, JESPA, and other representative groups agree to work together to enhance food service operations and will continue to improve and provide quality and nutritious meals for all students. It is essential for each stakeholder to understand program regulations and limitations that may exist in seeking desired outcomes around these meals. The group will work together to develop a shared vision, build trust, and establish respect for all stakeholders, and implement changes to achieve the shared vision for school needs. So going down to the purpose and structure. Purpose is to develop a common vision and goals for continuing to enhance quality, nutritious meals for all students and to work together to complete these goals. Then we are going down to, I believe, the next change is in the working group under the list of working group members. The working group will listen and seek to understand the current status and constraints FNS and FNS will listen and seek to understand the perspectives and requests of the working group, especially parents and students. The working group will be responsible for the following: consistently attending meetings and engaging in discussion and action to collaboratively achieve the shared vision. It's a little messy here. So collaborating to create a shared vision to include multiple operational methods for achieving vision to create steps for achieving the shared vision. Leading alongside food service staff on menu and recipe development, as well as taste testing the exact recipe used in cafeterias. And leading the distribute going down. On completion of each school year, the report detailing measurable outcomes and recommendations to include progress as well as challenges will be submitted to the district cabinet and Board of Education. Recommendations for the following year will be made following an analysis of the report. So then we added a whole new section header with a heading of staffing. It's been, I'll speak a little bit to this one. It's been clear from the last 2 years of the pilot program's beginning that the workload, the skill set necessary to have a successful program in the kitchen, there's going to need to be investment in training, in wages, in making sure these kitchens are able to do the work. So that's the interest here. There's also an interest in showing that we are treating kitchen workers as professionals. Over the last decade, there has been a shift from cooking and prepping and really creating healthy options in our kitchens to taking frozen food from a freezer and just throwing it in an oven. And we want to bring back this sense of pride and professionalism in our kitchens. I want to give a little credit. There has been a shift a little bit in that direction, but we need to see more. So staffing. FNS will commit to staffing the affected kitchens fully in order to maintain and achieve the commitments stated in this MOU. Additional compensation for kitchen staff must be negotiated through a process of reclassification and updates to job descriptions by August 2024. The funding section. FNS, with the cooperation of the stakeholders, will commit to seeking grants and alternate funding sources for necessary ingredients, equipment, working group support, and staff support. Now in the duration. This is a big shift. This MOU will never expire. Food service is committed to being a willing and honest participant in conversations with the community as it relates to quality and nutritious meals for all students. Food service is committed to working alongside the working group to advance and promote food that is minimally processed and maximizing the use of local products. Then the last thing we changed was down. Instead of Vicky signing off on this, we added me to be the one to sign off on this. That's it.
Great, thank you. We'll hold our questions.
Don't have any questions.
At this point in time, we'd like to take some time to look over the proposal and written form, and then follow up with questions you may have.
I would ask that if there are Katie is here and Jeff Batman is here, that we could try and come up with some questions to ask the parents who are attending tonight. Interested in this conversation. On this work, but we would appreciate if we could entertain asking these questions while nobody is present.
Understood. Do our best. Next on the agenda, we had JESPA financial proposals, compensation and benefits. You ready to present that?
I'm gonna send you this proposal now, and then if you could give us 2 minutes.
Oh, the FNS. Okay.
Matt, I have a real quick question for you. Since we do have those parents sitting here, the district is sitting with $211 million in reserves. What's your explanation to these parents that struggle to put food on the table and rely on the district to provide 2 meals a day? What's your explanation to that as to why you can't provide healthy meals? When you sit on $211 million of their money that's supposed to be spent on their children.
Hey, Robert,
I don't mean to interrupt you, Brett, but I'd like to hear from a stakeholder. Matt, I apologize, it's Brett. I thought it was Brett. Sorry about that. But we'd like to hear from a stakeholder. The taxpayers didn't give you any money. The taxpayers gave Matt the money. So Matt, what's your explanation to the parents as to why you can't provide healthy meals to their children?
Robert, if we can hold on for just a second, this isn't cross examination, okay? And even if it was, that'd be objectionable, right? Because it lacks no foundation at all right? So we're not here to answer questions like that, all right? Just as if I wouldn't put you on a spot, making you assume things that you don't know to be true and pose argumentative questions. That's not where I'm looking at the list of norms that I think you negotiated, and I think this line of questioning is out of bounds. So I'm going to tell Matt that he shouldn't entertain that question. And why don't we stay on the agenda?
We are on the agenda.
Are we talking?
The facts are the district's financials. These weren't made up. Have you seen the financials, Brett?
The financials?
Yeah, their financial statements.
Yes.
So you know that they have $211 million in reserves. So could you please explain?
Listen, I'm gonna shut this down. I want to be respectful of the fact that we have families here, right? Who would very much like to hear district's questions related to the FNS they're interested in. That Xander asked us to get to. So let's move forward with the next agenda item. I'm not gonna answer your question.
We're gonna caucus for 2 minutes.
Jesus Christ. Hey. I know.
Okay, we are going to get into our compensation proposal in a moment. I just want to be clear that we are all here together, we're talking. And so the parents understand that we're all negotiating and working together. So kind of the divisive, don't talk about the things you want to talk about because the parents are waiting isn't going to work to divide us. So we'd appreciate that our perspectives, even if you don't like them, that you hear them. And with that, we'll get into our financial proposal.
All right, let's get into the compensation. So currently, the district, as I said earlier, sits at $211 million in reserves. That's annually growing at 19 million a year. Last year alone, you underspent 30 million. The state only requires you to have 3%. Jeffco's policy adds an additional 4%. That's 7%. Currently, the district sits north of 26%. Damn near 4 times what the required amount is. You are getting record pupil per pupil funding from the state. So I don't want to hear about de-enrollment. These schools have more money than they've ever had in the state of Colorado. Conservatively, if you took your $211 million that's in reserves, invested it in a CD, you would get a return of no less than 5%. That's an additional 10+ million added to your principal without ever touching it. So when we get into these, financial statements and what we're asking for, clearly have plenty of money. Colorado, at this point, defines the poverty line for a family of 2, $24,000. Our members, your employees, sit at or below that number, several of them. We are no longer in a position to talk about, let's get a livable wage. We're talking about trying to get employees, your employees, our members, above the poverty line. That's sad to me, that we shouldn't be in that state. So let's get into our proposal.
I think we're gonna go to Xander and talk about benefits a little bit first before we put the slide up. I don't have it ready.
Okay. We said we spent a lot of numbers doing surveys, trying to understand where we are with benefits. I want to share some stories. I want to share some perspective from our people. The lower cost of the Jeffco insurance would mean I could actually afford it. As of right now, I am the health aide. I am frontline for all major sicknesses, and I take my job seriously. However, if I were to get sick or catch one of the many illnesses that warrant a doctor, I couldn't go. The healthcare cost from Jeffco far exceeds the amount I make. I had to make the hard choice of healthcare or being able to afford to live. I have a lot of health issues, and even though I'm on the low deductible plan, it's still a huge hit to my wallet. Unfortunately, out-of-pocket costs hit me. I had some medical stuff take place this year, and unfortunately, I have a lot to pay. I have a $2,000 medical bill from the hospital that I haven't even started paying yet. Another large bill, and I need to pay in $140 a month bills. Plus, I had lab bills, all came as a surprise. I try my best not to utilize medical services, as I never know what to expect bill-wise. I struggle to afford my typical month-to-month expenses, so why add a medical bill on top of it? Jeffco's health insurance feels like punishment to be given no options for work that is already underpaid. It's the worst, covers nothing important, it's too expensive with the deductible and co-pays to even use it. Cannot afford to cover my children, would have little to no income remaining. It's impossible to have the money for treatments, so you just do the bare minimum, which is not self-preventative. Over half of my pay goes to pay our insurance premium. Typically working for a school district, you accept a lower pay because the medical benefits are good. I don't qualify for medical benefits at 5 hours per day. I am on one of the lower out-of-pocket upfront plans, but with the highest deductibles. Still, the monthly premium keeps going up and my working hours are worthless. I am terrified of something major happening, as that deductible is obscene. His 200 insurance. It doesn't include his doctors, which are considered seeing a specialist. My own prescription cost is around $100 a month, and that's when I can't afford to do that. I go without so my son can have what he needs to live. That's after paying over $600 a month for insurance. I had to have a CT in urgent care, almost $1,000 that I'm still paying. I would go to the doctor when I needed if the costs were lower. Too much out-of-pocket expense. I am on a CPAP and cannot get a discount on my supplies until out-of-pocket is met. Supplies are not cheap at regular price. Have to have the unit to keep my job. I require 6 different daily medications that help my various chronic illnesses. And with the copays for both appointments and medications, I cannot afford to be on all my medications on the Jeffco insurance. Lower costs would mean the ability to stay on all my medications and be able to go to the appointments without fear of being unable to pay the costs. Needed a diagnostic scan last year, and my out-of-pocket cost was going to be $600. I didn't get the scan. I am still experiencing symptoms of the issues. This is a small snippet and picture into what we experience because Jeffco health insurance is incredibly expensive and not good care. I'll say the plans that we're on are expensive. So it's not Jeffco healthcare, it's the health insurance companies. But when we talk about benefits, we want to express that we have been working on this in the back. We have been engaged with communication and talking to the school board. I believe there was a presentation on benefits to the school board earlier this year on the obscene costs of healthcare for employees. Jeffco has been paying a flat rate for health insurance premiums for as long as I've been here, and I'm sure much longer before I was here. Cost out of pocket for premiums for employees has gone up and up and up, and it's not stopping. Now, our proposal is an attempt to solve that issue. We are asking that the district pay a percentage of our healthcare premiums and not a flat rate. We can probably turn to the slide here now. And this is what we are proposing more in detail. So we would like the district to pay 100% of employee-only medical plans. And we would like all of the other medical plans to be paid at 80% district and 20% employee. That's it. we've done work in back to show that this makes families, people with children, able to utilize Jeffco health insurance. There have been so many times I've been out in buildings and talking to workers who can't cover their children or their families because they won't be paid any money. That entire paycheck goes towards premiums. It is insane. We know that there is interest from the district in solving this issue. I've heard it directly from school board members. So it's in alignment with what Jeffco has interest in. Nikki, would you like to go next?
Thanks, Sandra. I'm just gonna piggyback on that a little bit, what it's like to be an ESP below poverty line. I am a health aide this year. I love my job. I was a preschool teacher 9 years prior. I love my job. I am one of the lowest paid ESPs in the district. I loved my job. I've also been told that it is used as a stepping stone, that people don't stay to be a health aide. I love my job. I'm here to stay. I value what I do. I am the lowest paid ESP in the district. I'm going to tell you, my take-home pay, my paycheck is $1,800 a month. If I were to pay for my family of 5 for our health insurance, my take-home pay would be $600. Can't live on that. I don't have a spouse. I'm a homeowner. I can't live on $600 a month. I can't pay for my family. I can't pay for my kids. I was so thankful that the district went for free meals for all, so I can afford to have my kids have a healthy lunch in school, because I can't pack that at home anymore because I don't have that income. I'm a homeowner. I don't have a savings account. I have $5 in my savings account because that's the minimum required. This storm this weekend was worrisome. I have a huge tree. I had a house built in 1960. There's a lot that can go wrong. I have 5 kids. One of them's in college. I can't afford to go pick them up in Gunnison because my vehicle won't make it. I don't have a dishwasher anymore. I don't have anything in savings. We haven't had a dishwasher for 2 years. I have a family of 5. I've had to use the laundromat for the last year for a family of 5. I have not a dryer. I have nothing in savings. I had to have someone buy my dryer for me. I was very thankful. We're not making enough money. I can't sustain what I'm doing. I love my job. I want to stay here and be with my students. I can't do that. I can't make that choice between what I'm making at what I love, and I'm a good example to the kids in my school and to my family on my dedication and what I put into it. I'm not getting that respected back. We need to make a living wage. We need to be above poverty line.
Sandra, so I'm looking at the collective bargaining agreement, about the 7-4, which I believe addresses the contribution. So I understand this would be a modification to that. Is that right?
If we could just get through our whole proposal, I'll open up the contract and look through that. It's on my computer here.
Okay, so you want me to ask questions about benefits at the end?
We're just still finishing our financial compensation proposal. So we've done benefits and yes.
So I'd like to share some stories about wages that from our fellow members. First one is making a livable wage would make paying my essential bills a lot less stressful. And I would have more money left over to buy food that I need without having to rely on my credit card like I do now. Because I'm using my credit card a lot. My credit has decreased this past year. And the once a month payments that I have to make is more difficult. More money into my paycheck would mean less stress level, and it would decrease, my stress level would decrease, and that would positively affect my mental health, as I would be able to save both more time and money and put it towards things that I enjoy, not just essentials. Someone else said if I made a livable wage, I wouldn't be forced to be in the position of choosing food over rent. For someone else, a living wage would mean not being food poor. I have a celiac disease dependent, and not having to stress on whether or not my transportation to work will fail me. My vehicle is 22 years old. Being able to care for my children who give me significant help. To care for my children who have significant health issues. Someone else said they would be able to afford food, gas, repairs to my car, fixing my teeth instead of having to pull them out. Just simple things, not living a paycheck behind all the time. For someone else, it would mean the world. So I would like for any of the higher ups in the district to do our job for a day and get paid what we get paid. They would be just as livid as we are if they were us. We cannot live with these wages and the constant rise of the cost of living. How can I afford rent, food, medical, any other monthly expenses on $1,700 a month? You can't. Making a living wage would mean we would not have to struggle to get by every single month. We would not have to rely on other people to support us. We deserve much better. Someone else said that I need to make $55,000 more a year to make a living wage. Let that sink in. I'll wait. Let me repeat that. $55,000 more a year. That would put me above poverty. A livable wage. That money would allow me not to have to sacrifice my needs. I could make the necessary repairs on my home, buy a much needed newer car, get the healthcare treatments I need. Currently, everything I make goes to ensure that my child never goes without while she sees me go without things all the time. Someone else. Even with excellent credit, I cannot qualify for an auto loan based on my salary. I drive a 2005 vehicle with 250,000 miles on it because I can't afford to buy anything else. My take-home pay barely covers my mortgage and HOA. I had to take in a renter, a stranger, to help cover the rest of my monthly expenses. Someone else making 20,000 more a year would mean we would not have to work overtime in multiple jobs and sacrifice time with our family in order to afford basic necessities. Someone else having a livable wage means I can actually live and travel to other places rather than just read about them. I would not have to worry about what choices to make about bills and groceries. If a family member gets sick or a pet gets sick or hurt and needs medical care, someone else. It would be great if I could not have to depend on credit cards to make it through the month. I would love to be able to build a savings account for when it is time to retire. Another, making more money would help my family out exponentially. It would mean college savings. My kids need a certain outfit or attire for an activity, and being able to go get it right away instead of seeing how I could manage to afford it. It would mean not having to stress about extra bills that aren't budgeted into my monthly budget. It would mean getting me closer to finally getting out of debt and being able to afford the groceries that feed my family. There are so many more things that would help, but I would also feel like I'm being paid to do all of the extras that the sped department expects of me. And I would also feel like they think I am a worthwhile employee. I want to live on my own and no longer be a burden to my parents and someone else who I currently live with my parents. I need to make at least double what I am making now to be able to live on my own. Those are from our members.
Thank you, Nikki. Thank you, Sarah. Let's get into our compensation proposal. Matt, keep in mind as well, again, you guys sit on 211 million in reserves. 211, that's growing annually at 19 million a year. So our first line, COLA, we're asking for a $5 an hour across the board raise. Second request is a step increase. Third request is longevity steps to respect long-term employees, including pre-K. We'd like our fourth one to be a pre-K wage schedule overhaul. Fifth request is twice monthly pay. something that the district does now, just not consistent. Sixth is extra duty pay. Per our JESPA staffing proposal that was presented, I believe, 2 meetings ago. Extra pay for interpretation and translations for bilingual ESPs. Our last one is that this be implemented July 1st, 2024 as an effective date of increases, which mirrors administrators in this building. And I will also emphasize that I don't believe that there's a single administrator in this ivory tower you call the Ed Center that is above or below the poverty line. Not a single one. And again, all we're simply asking is get your employees, our members, above the poverty line. You're sitting on $211 million. Taxpayers' money, not your money, taxpayers' money that should be spent on their children.
It's at the end of the financial proposal. Did you put the most recent slide back up there? Number 1 and 2 are fairly clear to me, but number 3 and 4, do you have something specific that you're proposing here? Like, for example, the pre-K wage schedule overhaul, what does that mean? What does that look like? Do you have something that you're gonna present?
We can, if you're willing to discuss and negotiate. The pre-K wage schedule has lots of different steps and levels, and different lengths. So it's fairly complicated, and it doesn't mirror the JESPA wage schedule. They're just different. There's more steps in certain levels of the pre-K work, so we'd love to work on that together.
I'd like to see what you have on for sure. Same question for number 3. Do you have longevity steps put together that you'd like to present?
Yes, and we can continue the conversation that we had last year and in wage committee. Our last wage committee meeting did not happen, but I believe it's rescheduled. So that's work that we would like to do together, that we have done some of in wage committee, and we started last year with the overhaul of the longevity steps. So we added a step 8 last year, which helped flow up the wage schedule to help get our longer term employees the advantage of having a step increase. So that's kind of the idea we're looking at. How do we compress the wage schedule? How do we make the pre-K wage schedule mirror more closely the JESPA wage schedule? And how do we just make it more simple and easy to navigate without so many holes where you don't get a step at all and once you're in longevity?
So just to make sure I'm clear, you don't have something specific that you're proposing. You're essentially proposing to engage in that discussion.
Yes.
So, with respect to number 6, they're the extra duty pay. So I'm looking at the staffing proposal, and so that's 20% of the guest teacher rate per hour. That's what that one is.
Yeah, that would be when you're being asked to fill in outside of your normal job duties. Yes.
Okay. Advantage. Would you mind putting it back up? extra pay for interpretation. I might have missed that. What?
We would like to see other districts do this, so our bilingual employees often get a stipend or an extra hourly rate. When they are pulled from their job task to interpret or to do translation.
Okay, so are you proposing to? I mean, I think one of the reasons why we're asking these questions when it comes to compensation is that everything, a lot of times comes down to cost. So to try to evaluate your proposals, helpful if we know, like, we want to use $1 an hour, or what's in the staffing proposal, I can understand. Yeah, we can understand. That's a defined figure, but for the things that aren't defined, I mean, it's hard. It's hard for us to say yes or no to something that, we don't really know what the figures were, just because we have primarily our responsibility when it comes to the financial proposals is to evaluate cost.
Yes.
That's part of the work that we have to do.
So, I mean, I think the main thing to focus on that's gonna be the most costly is a $5 an hour and step increase is gonna be applicable to all employees. And we can work to cost that out. Vernon can cost it as well, and we can arrive on what that costs. As far as how we've talked about longevity steps and those kinds of things in the past, we generally discuss them collaboratively and figure out how they're going to affect the wage schedule in other ways and can cost them jointly. As far as extra pay for extra work, that's some of that's in our staffing proposal. We weren't even sure you would be willing to have a discussion about it. So part of this is we want to see what you're willing to talk about.
Well, certainly, things having to do with compensation they're proper for negotiations, right? So yeah, I mean, I think that I guess I'm a little confused about the process to which you're referring with respect to longevity pay. I mean, does that mean is JESPA hopeful that some agreement on longevity pay will be made as part of the tentative agreement here, or are you saying that we want that, but it's kind of done outside the agreement?
It's not done outside of the agreement. We generally work on it collaboratively through bargaining.
Okay.
And so I believe last year, years past, Brenda's usually here and available to discuss. There are sometimes we're building a model together, or she's built one and we've got ours and we're comparing notes on costing and what different options cost.
If I recall though, I think last year you had a model in mind, and that's what makes this more complex, is that there's not a model being proposed, it's just a concept at this point, so it's hard to evaluate the cost, the total cost of the compensation proposal that you're presenting right now.
Well, we can present a model, but we generally open with the concepts of when we make the proposal. So we can provide spreadsheets, we can provide models.
I mean, you can provide whatever you like, of course. It's just helpful for a management team to kind of know what you're, like, what is it that you want? Those issues. Okay, well, so I mean, I guess that's what we would, if you want us to entertain a proposal that
Has numbers behind it.
yeah, I mean, that's what we need.
We will make you a spreadsheet right now with all of this on it and cost it.
Okay. To that end, that was the question I was going to ask about the benefits. I mean, I understand 100% of employee only and 80-20 for everything else. So, how is that? I mean, I understand that it's being portrayed as an increase to what. Have you gone through to figure out what that would, what the cost of that would be?
That was a majority of the work the Benefits Advisory Committee did this year. So yes, it's been costed. You can check the work back.
Okay, so, sorry, do you know the cost? What is
Benefits,
the cost?
Benefits Advisory Committee is a meeting that takes place between JCEA, JESPA, and administration. And they have costed this all out, and they then make a recommendation in their work to the board and to the bargaining teams. So
They've costed your proposal.
it's a collaborative group called the Benefits Advisory Committee that works together to make a recommendation on what should happen with benefits. So yes, I believe, is it Adam or Adam Barnett?
Can you tell me how much that will cost, or do you not? You know or not?
Do you know, Matt?
Yeah.
Do you know what it costs? You have no idea what those three cost.
That's why we're asking.
So many members of your team sit on the Benefits Advisory Committee. Steve Landrigan sits on it.
Sure, but I don't think about this specific proposal that you're putting forward has.
Well, I mean, we'll share the Benefits Advisory Committee recommendations and the costs.
Great.
There's probably a cost breakdown of it as a whole for the whole district because administrators are included in those recommendations as well as JCEA. If you want us to break it down for JESPA, we can do that. There's a model that I believe Angela shared in the Benefits Advisory Committee. I don't go to these meetings. Trevor and Sarah and Xander do. So they have the data from the meetings. It's in a shared drive that the district has. We'll share them. I need to get access to it and we share the documents with you that they've created.
I know they've done costing, to answer your question, but I didn't know that this specific proposal that you put on the table tonight is gonna cost it out, and I think that was the essential
sure
question
is.
is how much does your proposal cost?
You have costing numbers for any of the things? that you
Yes,
proposed?
we have costing numbers for all of the things.
Okay, would you share those?
Yes, we will share. I'm not gonna put the spreadsheet on the screen right now because it's costed based on every employee. So generally,
Yeah, that, I'm not asking.
yeah, well,
That have to be now.
yeah. I mean, we've never gotten into this in the immediate second after we've put the concepts, and neither has the district. So we've asked, when the district makes a proposal, we ask about costing, we ask about things, and we've never gotten into like immediately 1 second after this level of, I want to see the detail of the costing. We generally work together to make sure we agree on a costing model and all of that. So we can go provide that, given that the district doesn't have folks here to do that with us. That's fine. We will provide cost.
Anything else
We-
on benefits or compensation?
We'd like to break for dinner.
Okay, how long do you think?
30 hour?
I think if we need to do full spreadsheets and send them to you, about an hour. So
To be clear, I wasn't saying I was asking if you had it now. You don't have to do it now. And totally up to you. You want to take an hour? Okay.
No pressure. Yeah, no pressure. Just ask it over and over.